Welcome to the Medical Top 10 channel. Today we bring you the top 10 grooming tips for paramedic students and new paramedics. Before we begin, please hit the subscribe button if you want more interesting top 10 videos on medical subjects. If you hit the little bell icon, you'll never miss a video. Getting your first paramedic job is overwhelming enough itself. You've worked hard to get your degree or finish your training program, and now you're just itching to get out there on road to start saving lives. But have you thought about what paramedics and patients really think of paramedic students and their grooming when they come out on road to work? Today's video is about the top 10 grooming essentials for paramedic students and new paramedics. Number 10. Your uniform. Coming in at number 10 is your uniform. Everyone notices the state of your uniform. Keep your uniform clean. Wear your uniform once. It doesn't matter if it was a cold day, you didn't do much, or you think it's clean. It's not. Wear a freshly washed uniform every day. Your ambulance service will give you enough uniforms to launder so you don't have an excuse for wearing a whiffy uniform. As a student, it's more difficult because you may only have one or two paramedic student uniforms. Rest assured, your crew can smell you and your uniform. Most washing machines have a quick cycle. Throw it in to freshen it up after every shift. Hang it up to dry overnight if you don't have a dryer. If it's still damp in the morning, use your steam iron to dry it the rest of the way. You should own a steam iron. A steam iron can be obtained cheaply from most large department stores. Finally, your boots. These should be polished. They don't have to be military perfection, but if your boots look like trash, people will notice. The devil is in the details. Number 9. Makeup and facial hair. Your makeup and facial hair should be in line with the service policy. You can be as emo, drag fab, or as extreme as you like off the clock, but while you're trying to get an ambulance job, you need to wear subtle and non-dramatic makeup. Like with nails and hair, anything that distracts the interviewing panel from your skills and personality only detriments your chances of being hired. When you join an ambulance service, you join a brand, and that brand has a culture, look, and personality of its own. Particularly government-based services, these are funded by public money, and the public does feel like they own you. Whether this is correct or not is outside the scope of this video, but be aware that the job you have and the service you represent is for the public and the community. They want to see their money's going to a worthy place. If you look trashy, messy, arrogant, or like you don't care, you will be hearing about it from the public. You'll be getting spoken to by the chain of command. These are real things, and the patch that you represent needs to be respected in public at all times. As a paramedic student, your crew are watching you. They can perform a rapid assessment of your uniform while you're having a conversation about something completely unrelated. When the ambulance bosses or university come to ask about you, these things will be discussed. Were you groomed appropriately? And do you look like someone who can be given a uniform? As for facial hair, since COVID-19, many ambulance services make it a policy for you to shave off your luxurious trucker or distinguished gentleman beard, so the P2 mask will fit effectively. A long or unwieldy beard also poses an infection control risk. The last thing you want is your fabulous ZZ top dangling into the wound of a patient. Number 8. Look good. This one might be a little controversial. You don't have to be pretty or handsome or anything in particular, but looking your personal best helps. If you're the most skilled or qualified, your chances are going to be minimized if you roll up to the interview looking sloppy, ungroomed, and like you don't care about yourself or the uniform. Caring is vital to getting the job. The one thing you notice about new interns is that their uniform and presentation is flawless because they care. Maybe 10 years down the track you won't care, but getting your foot in the door depends entirely on how much you care. If the panel has to choose between two equally qualified candidates, the one who is better groomed and presented will have the edge. Think about how you would like your paramedics to be presented if they were coming to your house. Would you trust the sloppy, untucked, greasy-haired paramedic to care about your medical condition? Number 7. Nails. Short and clean is the ideal. Nails harbour a plethora of bacteria. If you're an acrylic nails wearer, reconsider your position purely from a bacterial infection control standpoint. Paramedics wear gloves, but consider the likelihood of a glove failure and the addition of infectious organisms you will be collecting and spreading under those nails. You can still have a nice manicure and polish if you're so inclined, but be sure to pay attention to the uniform policy rules of your service. Particularly when you're trying to get a job as a paramedic, you need to be sure you don't stand out for the wrong reasons. Skip the Cardi B nails while you're job hunting. You want to make sure you stand out for the right reason. If the panel of interviewers is staring at your bright violet almond-shaped acrylic nails and unicorn hairstyle, they are not paying full attention to your skills and attributes that will win you the job. First impressions and appearance counts, whether you think it should or not. Humans are designed in nature to judge. We judge for our own personal safety and a variety of reasons stemming from our old lizard brain. Minimize the amount of attention that is being drawn to your appearance by finding out what the uniform policy standard is for the service you're applying for and sticking to that. Number 6, smoking. We don't need to tell you about the detriments to your health of smoking. You went to university, you know how the lungs work. From a grooming perspective, honestly, smokers stink. If you must smoke on a shift, go far away to the smokers area and make sure you have gum, mints, and an appropriate masking spray for your clothes. The patient does not want to be in close proximity to smokers' breath and clothes. This is a harsh one, but for non-smokers, few things are as repulsive as the smell of a smoker. Number 5, perfumes and colognes. Don't ever spray your perfume, deodorant, or other personal smell items inside the ambulance. Ever. Paramedics are sensitive people, which is how they're able to observe and perceive fine details of situations. If you douse yourself in perfume or cologne, not only does it irritate your partner, but it clings to the seatbelt. So when your partner has to drive, your cologne or perfume is rubbing off on them. Fragrance is highly subjective. Don't presume that just because you love it, your partner does as well. If you need to spray dry shampoo, body spray, or anything else, do it away from the ambulance. Number 4, deodorant. This one is short and sweet and should be the most obvious. If you like to use crystals or good vibes to keep your stinky pits at bay, you might want to think again. The only thing that works for underarm body odor is a proper contact antiperspirant in stick or roll format. Sprays mask the smell and only get flimsy coverage of the sweat gland area, in addition to being irritating to the senses of other people when sprayed. Find a suitable antiperspirant stick or roll-on at your supermarket or pharmacy. Most paramedics work 12 to 24 hours, and you best believe that deodorant needs to be reapplied. The conditions can be hot, heavy, and smelly, and you don't want to take your sweaty pits to the next patient who has to share the back of the ambulance with you. Number 3, your breath. Eating in the car and never knowing where you'll be means you eat on the run a lot. Once again, small space and bad breath does not a comfortable working day make. Always carry mints or breath freshener. If you chew gum, be aware of the policies of your service, who may ban it for a variety of reasons, including protecting equipment and also how chewing is perceived by the patients. Carry your toothbrush and toothpaste in your safety kit, so if and when you get a chance at hospital or station, you can brush your teeth or rinse with mouthwash. Check your teeth regularly. You're facing the public, doctors, nurses, and patients, and you don't want to sit talking to a patient for 45 minutes on a long ride with a large piece of spinach stuck in your front teeth. Number 2, hair. You might like swishing your hair around a hospital to try and capture the attention of that hot doctor or nurse crush, but we can tell you that hair is a massive infection control risk. If you have long hair, tie it back, especially for the interview. On the interview or assessment days, you want your hair to be very neatly and tidily restrained so it does not draw attention from your clinical and personal performance. Just remember that you will encounter many infectious bodily fluids in a shift. Do not run the risk of letting your hair trail in things that might make you or your family sick. Keep your hair out of your eyes. You need to read drug vials and perform precise needlework. If your hair is dangling in your face, your ability to see is impaired. Being cute does not outweigh being an effective clinician. And our number 1 tip, just be clean. Just be clean. You work in confined spaces on jobs with colleagues and patients. Everything from your hair to your body odor to your clothes can be smelled by your colleagues. Have a shower every day before shift and wash your hair or make sure you use dry shampoo. Always be clean for work. You won't be clean by the end of it, but at least you started out clean. This may seem super obvious for most people, but it is amazing how many people think they can sneak it by. Take care of your hygiene at all times and save yourself the awkwardness or the embarrassment of someone having to tell you that you're a little on the nose. Well, that's it for today's Top 10. We hope you've taken on some good tips to manage your ambulance interview or on-road prac time. Don't forget to subscribe if you want to see more content like this. Comment below if you think something else should have made the Top 10 or share your favorite grooming tip. Until we meet again, so long!